Welcome to Healthy Mind Science, a show dedicated to translating youth and young adult mental health research into the real world. We have conversations with experts in psychology, neuroscience, human development, computer science, education, and more, with a focus on helping parents and educators take research findings into their everyday lives to ultimately better support our young people. Healthy Mind Science is an affiliate of the Center for Healthy Mind and Mood at University of Colorado Boulder, on a mission to promote emotional resilience and healthy mood in every young person. I'm your host, Alicia, and today I have with me Dr. Ryan McBain, who is an assistant professor at Harvard Medical School and senior policy researcher at RAND. So thank you so much for being on the show.
Yeah, excited to be here.
Yeah. Well, why don't you tell us a little bit about kind of the work that you do, and then we'll dive into some of your research.
Sure. So most of the work that I do is on adolescent mental health. I'm particularly interested in programs and policies that are meant to improve access or quality of care, particularly around mental health services for young people. If I can't do that with some of my projects, then other areas more generally is focused on mental health programs and policies, as well as for folks who are dealing with sort of chronic homelessness is an additional area. But yeah, mostly focused on policies and programs, sometimes from an economic lens, just because you can often persuade folks in Congress or elsewhere to invest in things if the dollars and cents are, make it adds up essentially from a return on investment perspective.
Yeah, it's like, from my perspective, it's like it's the right thing to do. Well, why don't you tell us a little bit about RAND? So what is RAND for folks who maybe aren't familiar with it?
Yeah, so RAND is a think tank that essentially means it's somewhere between an academic institution like my appointment at Harvard and at the other end of the spectrum, like a consulting firm like a McKinsey or Bain or BCG, but is largely focused on providing services in the public sector. So oftentimes consulting firms are working with private companies to help maximize profits, among other things, whereas a think tank like RAND is focused on the public good. And so RAND is nonprofit and nonpartisan and is mostly focused on, again, policies and programs evaluating what works and giving that information to folks on the Hill, for example, in Washington, D.C., which is where I'm based for most of my time.
Wonderful. Thanks so much for sharing that. So today we're going to dive into AI and youth mental health. And I think it's a hot topic. It's one that I'm interested in because, I think social media generally has been talked about a lot, and also still has so much research also to do in that space as well. And that's been around for so long. And then AI is coming around, and it's this new technology that is very different in the way that we interact with it. And so I think that especially for young people, we just kind of understand it. We need to understand it faster than we maybe have and do with social media and other technologies as well. So I'm excited that you're working on this area, and also in your role too, kind of thinking about it from the research and policy side. So thank you for what you do, first off. But why don't you tell us a little bit more? Yeah, like, what is your research interest, and then how did you get involved and interested in this topic?
Yeah, so I'm interested in any new technology that is, in theory, meant to improve access and quality of care for health services, particularly mental health. The way that I got into this actually has to do with telehealth during the COVID pandemic, right? So for a lot of health services, you really kind of need to go in person, right? So if you're getting a colorectal exam or a mammography or something, like, you have no choice, you have to be there. But for mental health stuff, that's not really the case, right? No one's probing your body at all. That you're just talking with people about what's going on in your life. Maybe you have some medication side effects or something that might require some testing, but generally speaking, it's something that you can do virtually. And what we saw over the course of COVID was that there was a huge shift, including among young people, in accessing mental health services in person to doing it online, right? It's easier, it's more accessible. You have fewer cancellations. It's just sort of a major convenience component. But one of the things that felt a little bit disappointing about this transition to the virtual world is that there isn't really a multiplier effect, meaning if you're a provider, now you can talk to people virtually, but it's not like you're suddenly going to see more patients each day just because you're doing it virtually. Like a visit is still 30 minutes long or 60 minutes long or whatever it is. You can just do it from the comfort of your own home when you're talking with patients. But where AI is, in theory, potentially exciting is that there's an infinite multiplier effect. Like if you had a supremely intelligent AI that could provide expert care, remembered every detail of prior conversations, right? It wasn't forgetful at all. Uh, the only limiting factor in terms of how many people could receive benefits from that would be like the computational power of the AI system or data centers or whatever it is, right? So there's potentially a huge impact. But then as I started to look into this issue, I was like, well, there are potentially really positive impacts and there are potentially really negative impacts as well, because the financial incentives might not align with sort of the clinical incentives or the goals of benefiting society. And so that's when I was like, this is a really cool issue. I want to dig into it and figure out what's really going on here. So, yeah.
Yeah, and I'm sure like the more that you're diving into it, the more questions that you have too. I think at a very, very high level, I've tried to stay sort of like current on new AI models that are geared and focused on mental health. But it's really hard to even create, test. Like there's so many layers in that, and how things are created, and then how they're tested, and then also then the use cases and what happens in the real world with that. And so I think like you're definitely onto something because again, the access and the quality piece, right? If we can increase access while maintaining quality or even having better quality potentially, that's a great thing depending on the risks, right? So really, really great. So you saw this kind of happening in telehealth, and that's kind of how you got interested, kind of just more remote, like how these kind of work together.
Yeah, I think that that's a good summary. And yeah, there is just a sort of a broader set of philosophical questions, I guess, that are also interesting, right? Like, what does it mean to be a person? Or what is a relationship between using AI and having a sense of agency or identity formation that's going on during adolescence? Like, these are all really important foundational things that relate to human flourishing more generally, right? And so I find it all very interesting intellectually, even at the same time that it is potentially causing a lot of panic, reasonably so, in the real world. Like, are we all still going to have jobs in 5 years? What if AI just takes over the whole world? Like, there are lots of different issues to be considering here, but I think that in sort of that panic about jobs or existential risk of AI, we lose sight of the fact that AI is just becoming integrated into the rhythm of people's daily lives much, much more so with every passing year.
Hmm.
I can, even just speaking personally, like I use AI to solve for all sorts of issues that I have going on. And so it's not surprising to me that teens might turn to AI for health related issues or challenges with school, right? Are they using it to cheat on homework, or are they instead using it as a tutor when the teacher's not helping explain things to them in ways that click, right? So there's a whole spectrum from potentially really bad and really risky to potentially really good and really beneficial in each of these areas.
Yeah, agreed. I also think there's this like instant component as well of like, oh, I can just go and ask it really quick if I have this thought that maybe it's just a thought, right, that comes to my head, but instead if I was working with a therapist or kind of processing my mental health, then I would kind of reflect on it, think about it for a little bit before I may talk about it with somebody. But then there's like this, oh, I can talk about it instantly. Sometimes that's a great thing, and then sometimes because again that access, right, and being able to access that like support in the moment. But also then yeah, it's just like this instant piece to it. So yeah.
Yeah, there's this term that I feel like has popped up quite a bit more recently that's called like low friction or high friction. And if you just want to get advice immediately, right? This idea of like, oh, I have a really low friction way of doing it with ChatGPT or some alternative AI. Uh, that can be really useful in a lot of ways, right? You just reach into your pocket, pull it out, you get an answer that is 80% accurate or good enough, and you're off to the races doing whatever it is that you wanted to do.
Hmm.
Uh, but sometimes you actually want something that's a little bit higher friction, right? Like if you're a teenager in a socially awkward situation. Maybe you want to ask somebody out on a first date. I don't know. You could have AI just generate, the perfect message for you. And then you're like, oh, well, AI did it for me. I don't need to stress about it and just send it. But maybe that awkwardness, maybe there's some benefit to that, right? Like you're really wrestling with stuff, at a time when your prefrontal cortex is still developing. And, it's, I don't know, like what are the trade-offs there? They're very subtle and they're not obvious in the way that like the trade-offs with something like, I don't know, Waymo or whatever is conspicuous because it's visible and everybody can kind of see it. So,
Yeah, yeah.
yeah.
This like intolerance of uncertainty, right? It's like we do need some of that in some ways, in some aspects, and yeah, it's super
Mhm.
interesting. Well, maybe let's talk a little bit about the study that you recently published, the article that you published, and I'll just I don't know if I should shout out all your co-authors. You want me to really fast?
Sure.
There's a lot of them, but
Yeah.
I'll just do last names. So this is in JAMA Pediatrics. AI chatbot use and disclosure for mental health among U.S. adolescents and young adults, and I'll link this in the show notes. And then co-authors are McBain, Cantor, Breslau, Diliberti, Ang Zhang, Burnett, Kaufner, Rader, um, Patarana, Toporn, Stein, Marotra, and you. So I did my best. There's a lot of them. I
Yeah.
love it. No,
Hmm.
that's so. Why don't you talk a little bit about maybe what inspired you with this study and yeah, what you were trying to understand?
Yeah, sure. So the title says a lot of it, right? Like we were essentially wanting to learn about how many youth throughout the United States are currently engaging with AI to address, potentially unmet mental health needs, right? Seeking advice. We had some intuition that that number might be pretty large, maybe surprisingly large. And if that were true, which we confirmed with a study, we found that about 1 in 5 young people are using AI for mental health advice, that it provides members of Congress or folks who are thinking about legislation to understand that now is probably the time to act because we're already seeing widespread adoption among millions of teenagers. Like, now is the time to get this right. Like, we don't need to wait until all 40 million teenagers throughout the United States are using AI for mental health issues, right? If 1 in 5 kids are already doing this, we probably want to make sure as soon as possible that the type of advice that they're getting is safe and that the quality of that advice is meets at least some basic standards. So that was sort of the motivation for doing this work.
Yeah. And when you define chatbots, what does that mean, kind of in the context of your study?
Yeah, that's a great question because chatbots have actually been around for quite a while, but AI chatbots, the way that we think about them today, it's a little bit different. So AI chatbot is using what's called like a large language model. So it's a generative form of AI that is text based, and it is using a very, very large algorithm to try to predict the next word in a sequence, and often chaining those words together through some underlying form of reasoning. So that's a bunch of jargon, but I mean, essentially what it means is that newer chatbots, especially starting around 2022, so just 4 years ago when ChatGPT really started to become popularized, is sort of the framework. And these chatbots look like ChatGPT, Claude, which is Anthropic's main chatbot, Gemini, which is Google's main chatbot. So now, if you just use Google, right, as a search, at the very top, it will say like, the AI summary version, and that's actually Gemini. So that's a chatbot, right? You can talk back and forth with that chatbot the way that you would talk back and forth with a human. And so it's sort of a narrative or text-based back and forth dialogue that the chatbot is doing, and it's sort of emulating human dynamic in that dialogue because it has been trained on human data. So there's a large sort of anthropomorphizing element of the conversation.
So, what else were you trying to understand with the study?
Yeah, so the
Or what
top
did you find?
the top line analysis that we were hoping to do was to figure out how many teens throughout the United States were using AI chatbots for mental health advice. But we wanted to break that down a little bit more. So we might find differences by age or by sex. We also wanted to know, are teens more often using this as a substitute, meaning an alternative to talking to a human? Or are they more often using this as like a complement? They're using it in addition to talking to humans for mental health advice. And then we also wanted to know how often they're doing this, right? Are they doing this every day, or are they doing this relatively infrequently? And then lastly, we were looking at how helpful young people perceive the advice to be, right? If they're finding it to be somewhat or very helpful, then maybe that's at least some sign that there's a benefit there, even if it's not clinically derived. It at least gives us a starting point of self reflection from young people themselves.
Yeah, I love that because it gets at kind of all these different components of frequency and how folks may be using it. And um, again, like in the context of another, like working with a therapist or not. So I think it gives a really good picture and layout with where we're at. And I think you all typically kind of do these annually. Is that right? Kind of what
Yep.
I'm seeing. And
Yep.
so, like, I think that's also going to be so helpful in a year. I think it's going to be drastically different. So yeah, if you wanna maybe you wanna talk about it, like, where it was last year, at the same yeah, let's do that.
Yeah, so that's a great point. So we started this annual survey a year ago. Well, I guess a couple years ago, technically. So 2024, in the fall of 2024, we did our first round of the survey. And at the time, we found that 1 in 8 young people, so these are ages 12 to 21, again, reported using AI chatbots like ChatGPT for mental health advice. A year later, so fast forward to November of 2025, so about half a year ago, young people reported, we found that 1 in 5 were saying that they were using AI chatbots for mental health advice. So just in 1 year, from 2024 to 2025, that's over a 40% increase, at least in relative terms, of adoption of AI chatbots for this purpose, right? And so, yeah, it's already a fairly remarkably fast trajectory. And as you're saying, I would expect that once we do this again in 2026, and we'll do it in 2027 as well, we're just going to find an upward trend. And we're hoping that as we do additional rounds of this, we can add new questions to the survey. For example, maybe we could have teens reporting on their own mental health symptoms as well to see, are teens who are dealing with greater mental health struggles using this more often for these purposes, for example.
Well, that's yeah, that's super interesting. I'm a qualitative researcher, so I also want to know, like, I wanna know, why are they using it? And, is it because they don't have access, right? Is it because I have so many questions around that, but maybe that's another conversation. Um, awesome. Okay, so what did you find in the results? What are the things that we should be taking away at a high level?
Yeah, great question. So some of the major numbers here. So I've already said about 1 in 5 teens reported using AI chatbots for mental health advice. Among older participants, so these are young adults ages 18 to 21, that figure was even higher. So it was about 1 in 4 uh, young adults are using AI chatbots for mental health advice. We also found that females, at least among those that we interviewed, were about twice as likely to be using AI chatbots for mental health advice. In terms of the frequency, sort of the typical rhythm was about monthly or so. So about 40% of respondents said that they were using AI chatbots monthly or more often for mental health. And then we also found that over 90% of young people reported that the advice was either somewhat or very helpful. And so I suppose that was a bit of a silver lining. Although, again, there's a whole separate discussion to be had here about clinical quality and safety apart from feeling like the results are positive for kids. And one of the aspects of chatbots is this issue around sycophancy or sort of over flattery, right? Just being really almost too friendly in a way, being very, very agreeable when actually there are probably some benefits to being disagreeable sometimes or pushing back on something that someone says. And so it could just be the case that teens generally feel flattered and comfortable in ways that persuade them to continue using chatbots for this purpose, which may have benefits, but it also might have negative consequences as well. But those are some of the major findings. We also found that among um, Black and Hispanic people who are using AI chatbots for mental health advice, that they were generally speaking doing so more frequently. Particularly, Black people were using it on a monthly basis about 5 times more frequently than white counterparts. So that was also kind of an interesting surprise in some of the work that we were doing.
Yeah, and I want to talk about this this agreeability of chatbots. And what's interesting is if young people think that it is somewhat helpful, they're probably going to go back to it. Like, right? Like if something in our lives is helpful to us, we're probably going to return to it, go get more, if we need more advice in that specific content. And so that's also interesting to me. If it's, and then again, like if it's agreeable, it's like, how actually helpful is it? And maybe that's enough if people feel better, but again, from a clinical standpoint, it's a little bit, it's a little bit tricky to kind of feel confident about that.
Yeah, I mean, the optimal study where we'd really like to head with this would be to ask teens, young people, standardized questions about their anxiety levels and their depression levels over time and see, right, maybe more usage over time for mental health leads to greater reductions in anxiety or greater reductions in depression over time. And that would be great if we did find that. We might also not find that. We might maybe even find the opposite. I mean, who knows? But I think that would be the ideal, would be not just linking it to do they feel like it's helpful or not, but do we actually see clinical improvements in individuals who were reporting anxiety and depression over time or not? So yeah, we'll see. We're going to start doing that in our next wave here in the fall of 2026, and then continue to do that in future years.
Well, we'll be excited to hear those results. So, and then you also talked a little bit about folks maybe substituting this instead of kind of using a therapist or clinician, or in addition to. So, I think that you also found some results with that, right? Is that right?
Yeah. Thanks for bringing that up. So, and just as a reference point for folks, um, so about 1 in 5 young people, teenagers in the United States, have received human therapy for mental health conditions in the past year. So that's an interesting corollary, right? That we also find that 1 in 5 young people are using AI, not necessarily for therapy in a formal way, but at least for advice. And there is an interesting question about like how much of an overlap is there between these two types of groups. What we found is that young people who had also talked to a clinician about their mental health issues in the past 6 months were about twice as likely to use AI chatbots for mental health advice, which would suggest that it's more along the lines of a complement than using it as a substitute. Although, even with that, it's a little bit hard to disentangle exactly what percentage of the time it's happening both together versus separately. And you think of it, so we asked about mental health advice. Mental health advice is pretty broad, right? It's not just therapy or managing your medications or something like this. Like it could be, I had an argument with my boyfriend last week and I'm trying to figure out whether we should stay together or not because I feel really hurt and I'm looking for feedback about what my next steps would be. Or I'm really struggling in this class. It is keeping me up really late because my grades are so poor and I'm having trouble sleeping. I mean, these are all sort of mental health adjacent issues where individuals might be seeking advice that doesn't necessarily require a human therapist. It's just, again, a question of whether AI chatbots in those contexts are providing helpful, feedback, and not just helpful in a way that you feel good about, but actually functionally helpful in resolving the types of situations that people are encountering.
Yeah, I think like the researcher in my brain also wants to download these chats, right? So somehow we talk to folks who are getting the mental health advice and then analyzing these chats too from like a clinician standpoint to really understand like is this something that we would discuss in a clinical, you know, setting.
Yeah, it's a great point, and it's something we've thought about a bit. So there are actually studies where they will pay people some amount to access their transcripts with a ChatGPT or whatever AI chatbot, and then they'll scrub them of any identifiers purposes of their analyses. But that type of information is very valuable. It's not collected very often. There's a website called, it's kind of a, a weird title, but it's called huggingface .co, and it's a website that has huge data repositories. So, for example, one of the most famous data sets that's on this website is called the Wild Chat data set, and it contains over 4 million Chat GPT conversations. And so you can look at it. Now, those conversations are relatively limited, right? Anytime I open up ChatGPT to have a conversation, it's a new conversation, so you're not really getting the same continuity as you would if you downloaded an entire transcript. But it does offer insights about the types of conversations or areas of inquiry that people are making of AI chatbots when it comes to mental health or more broadly kind of social or interpersonal dialogues.
Yeah, and especially with young people, we know that social influences and peer relationships are like so critical and really can impact folks' mental health for better or for worse. So that makes a lot of sense. Um, I think that there was one other thing that I wanted to dive into. The other thing was around the amount of young people who are using it, who are sharing that they're using it for mental health advice with an adult. Can you maybe talk a little bit about like what you were trying to understand there and then what you found?
Yeah, so one of the other big issues that we were thinking about is this topic of disclosure. So if young people are using chatbots for mental health needs, are they at least telling other people about this as well? Whether that's a parent or a teacher or a clinician or even a friend, right, a peer. And what we found is that about 2/3 of the time, young people are not disclosing this to anybody else. So it's just between them and the chatbot. I imagine for parents or for teachers, a little bit unnerving, right? You'd hope that you would know that this sort of stuff is going on in your kids' lives, and not knowing that, I think at least creates an impetus on the part of adults to ask openly, hopefully curiously, rather than in some sort of accusatory manner to say, hey, I heard recently that a lot of young people are using AI for all sorts of stuff, including social conversations and addressing issues going on in their lives. Is this something that you've been doing? Um, I think, hopefully it's an opportunity for learning among adults as much as it is for young people. Um, but yeah, it is, certainly an area that we were a bit surprised what we found there. And I think we would hope that those levels of disclosure would have been higher and maybe will be higher in future rounds of data collection.
Yeah, I think parents, let's kind of, I think, transition into some practical takeaways for, parents of young people, educators who work with the young people every single day. I think there's a lot of doom and gloom out there. And I'm sort of guilty of it and to a certain extent. And I'm like philosophically just interested too in like, what does this mean for humanity? And what does this mean for our mental health? What does it mean for how we interact socially? Like, there's so many like these, bigger philosophical questions that I have in my head. And there is a lot of doom and gloom out there. I think for me, I'm trying to also hold out like this hope piece as well. And I heard this kind of quick little, baby story about like how to think about AI of like in 10 years, one of us might have a child who is dealing with something that is complicated and confusing. And instead of taking 5 years for that kid to be in pain and confused and whatever, that like an AI, can help get to that diagnosis in 3 months instead of, after multiple, testing or whatever, right? And I think, like, for me, that gives me hope of like, yes, this could be really positive for health, for mental health, for our future as a humanity. And also, like you were talking about, we need standards, right? Like we need to talk about this in a way, especially with young people, because we know that as a young person, there's just vulnerabilities. There's a lot more risks because of the development that our brains are going through, social development. There's just so much happening among young people. So how do we protect them, right? Like how do we protect them and support them? Because we do need to do a better job of supporting them with quality care, access to quality care. But how do we do that, right, in a safe way? So what can you share with parents and educators? What do they need to know, maybe based on your findings first, and then maybe talk more broadly?
Yeah. I mean, I have so many thoughts here. I think one thing that parents and educators probably should keep in mind is that when young people are using chatbots for mental health advice, what we've seen in some of our own work is that the types of issues that they're discussing tend to be relatively vanilla, right? They're like, I'm anxious about these types of situations. What advice do you have for me? And the output that you will see from these models will talk about the sorts of things that tend to align with evidence-based practices. So, for example, go for a walk, talk to a trusted adult, uh, practice mindfulness meditation. It's important to get good sleep and nutrition. Like, the general things that you would probably want to hear most of the time. And that's just because, like, the center of the distribution, so to speak, for people with mental health needs are these sorts of common mental health concerns. It's much less common that young people are dealing with, say, suicidal ideation or active psychosis that are much higher risk. And if a chatbot gives problematic advice, could become really big issues. And that does happen. And that's a separate area of research that I've also spent time working on. But it's just to say, going back to a point that you mentioned earlier, Alicia, that like there is this kind of like potential for excitement for good, that you could get to a diagnosis earlier, that you could get to supportive guidance in a way that is potentially positive and beneficial. Um, I also think it's somewhat helpful, or in my view, it could be helpful for parents and educators to separate sort of three different tiers or categories of mental health advice. So the lowest level is just kind of using AI as a social companion or a friend to chat about everyday problems or issues that are going on. I actually find that to be almost the most problematic category in a way, because it's creating a sort of synthetic, a sort of fake dependency or attachment that could act as a substitute for replacing human relationships. It's these sort of areas that we've talked about before of identity formation, low friction versus high friction, that are sort of pushing kids towards maturation and development. And I would be very nervous if I found out, for example, that a teenager in my life was using AI just as a friend and companion every day rather than talking with humans. Um, so if parents or educators are learning about that, I think that it's something to be attuned to. And it's one of the areas that we honestly have the least research, right? Because it's such a soupy, hard to characterize area that's probably happening every day with many, many, many teens all the time that we just don't know about. And we're not going to know what the consequences are until we follow kids over a long time and measure what the outcomes are. Really not unlike social media use with Instagram or Snapchat or whatever it might be. Now, the other categories, so a second tier, right, would be this, what you were sort of describing around diagnosis or therapy or treatment. And in those categories, like there are companies that are designing specific, they're called like, for purpose or purpose built chatbots. Like they're made for doing this stuff. They're made to do diagnoses and to do therapy or whatever it might be. And so for those, there's sort of a higher standard of assessing clinical quality and safety. The training data sets that are used for them look different. Usually clinicians are involved in evaluations and whatnot. There are ongoing trials that are looking at this for different platforms. So for that, it's still early days, and I wouldn't feel particularly comfortable letting a young person play around with that right now. But I could imagine in a few years that these could be quite valuable if they were vetted through clinical trials and such. Um, so that's something also to pay attention to. And then the third category are what I would call sort of mental health emergency situations. So where you might find somebody who is, I don't know, meditating on a school shooting or something like this, or has active psychosis. They're having hallucinations or delusions and they're talking to a chatbot about this. So for these, I think we really need federal and state regulations that aren't in place almost anywhere except for a few states that have very light touch regulations right now. But you would really hope in those situations that a chatbot would actually provide a response. Like you don't want an error message or a chatbot to say, I hear that you're suicidal, but I'm just a chatbot. So sorry, go away. I think in those situations, you would want a chatbot that's programmed to refer young people to a trusted adult, to a mental health emergency hotline, like the national hotline 988, or something of that sort, right? Something that de escalates the situation and diverts or refers the individual to a human expert. Um, so I think these are sort of three different types of scenarios, and each of them call for different types of responses that parents and educators should be thinking about differently.
Yeah. And I think, one of the things I just want to zoom into just like practically for parents and educators is have conversations. Like how are you using it? What are you using it for? Can make jokes about it. I don't know. Try to like make light of it, at least at first, to just kind of open up the conversation. But I think, yeah, I think we have to lean in to this and we can't just kind of hope that folks aren't using it because if 1 in 5 are using it for mental health advice, that means that there's more people just using it, right? Using these chatbots just for other purposes that then could also, like, if I'm using it to try to learn a new tool or learn how to, analyze this thing and I'm trying to figure out code and I'm like, oh, how do I adjust this thing? And then I'm like, oh, that was really helpful for that. Oh, you know what? I'm going to see if this problem that I have with my colleague or whatever, see if it can help me with that too, right? It's like, it's an easy transition into that too. So if only 1 in 5 currently are using it, it's just, yeah, it's likely, again, your teen or young adult is using it in some capacity. So just having the conversations about how to use it safely, right? And be thoughtful and mindful, and also to keep the conversation open up to you as a parent or educator, that you're okay to have these conversations even if you don't know the answer. And that's something in the data whenever we talk to young people, they're kind of like not asking for much from us as adults. Like they're not asking for us to do much. They're just asking for us to be there and to have and to listen. So, yeah.
Yeah, I agree with all of that 100%. I think about, there are a lot of different corollaries here. I mean, when I first started using AI chatbots, almost like as a replacement for Google, right? I found it to be really helpful, but I would talk with other friends, colleagues, and they would laugh and say, "Oh, don't do that. It gives terrible information. It's really inaccurate and it hallucinates." And it's like, yeah, I guess maybe the earlier models did that more frequently, but the
Right.
the pace at which they're improving is really quite remarkable. And so I don't think that coming from a position of sort of stigma or hostility or kind of, I don't know, like just kind of an adversarial nature towards AI would be particularly helpful, because the reality is that these models are getting better and better. They're more and more ubiquitous. Um, and they probably oftentimes do provide thoughtful insights. And so, yeah, I think a starting position of humility and one of inquiry is really important. And thinking for myself, like as somebody who I consider myself to be somewhat of an expert, at least in the sense that I've done a lot of research on these topics. And I don't even know, right? We're at such an early stage here where we're all kind of figuring this out together. And everything is changing so fast that I do research, 1 year, and a year later, the landscape looks completely different. So I do think that, if I were having this conversation with anyone, forget about young people for a second. I just be like, yeah, it's such a complicated situation, landscape. I can completely understand why people who don't have access to resources otherwise, right? So like half of teens who have mental health needs, they're unmet, right? They haven't met with a clinician about it in the past year. So there's a lot of unmet need that potentially AI is trying to fill in some of the gaps. That's not necessarily a good thing, but I don't know. Like, I think that having a messy conversation with a young person from that position of like, how are you doing this and how have you found it and what have been some of the challenges might make them feel more comfortable, and it's more disarming, and it leads to a more positive outcome where you learn more about what's going on in their lives. So yeah, I'd consider it as an opportunity, because I imagine young people probably find AI to be really fun and interesting as well. And so starting from that position can open up a whole new dialogue.
Yeah, and I think what I appreciate kind of about your stance too is like you're open, you're learning about like what's happening, right? And doing the research. And you're also like, how do we protect our young people too? So it is this like hope and concerns and risks, and you can hold all of that, and also we can still protect our young people until we sort of like understand it a little bit better. And so like I really appreciate kind of that perspective. And I think it's one that educators and parents kind of want to hear and need to hear, that it isn't just all stop using it. This is the worst thing ever. Don't use it. It's gonna, take over humanity. Because I don't think that that's a helpful conversation for them or for any of us really. So it's still like really great to have this kind of like protection up. You want to have this layer of protection, this layer of hope, this layer of opportunity, and also like we need to be talking about this with our young people. So yeah.
Yeah,
Well, anything else that you want to share before we wrap up?
I think you did a better job summarizing it than I did. But I mean, just to pare it back to a little bit, I agree. I think that the most important takeaway is that this is a really nuanced issue, and we don't want to be uh, overreactive either in this is such a great thing and now kids don't need human therapists anymore, and at the opposite end of the spectrum, the sort of doom and gloom attitude that you described as well. I think that it's a nuanced landscape, and unfortunately I think parents and educators are going to need to keep tabs on what the newest evidence is showing about the safety and quality of the newest models. My hope is that there will be regulations at federal and state levels within the next year or two that will give parents almost like like a nutrition label or some sort of scorecard where they can kind of see where these chatbots are doing well, where they're not doing as well, and can kind of speak to young people about that to give them some feedback, or at least information for them as well as they're deciding some of this stuff. Um, but it's a new world for sure. I mean, we live in interesting times, and I hope that this leads to more good than bad. Unfortunately, we're all kind of strapped into the roller coaster together, and we're going to find out.
Yeah. Awesome. Well, thank you so much for your time. I really appreciate it. If folks want to connect with you, are you open to them connecting with you on LinkedIn?
For sure, yeah. More
Awesome.
folks, the merrier. Always happy to have new conversations with folks who
Yeah.
are interested in these issues.
Awesome. Well, make all of what you just said happen. Okay. So we can make it easier for educators and parents and on our young people to have some quality interactions. But thank you so much, Ryan. Appreciate your time. And yeah, thanks so much for joining the show.
My pleasure. Thank you, and thanks everybody for listening.